Hello, everybody. How are you all doing today? Well done for making it into the room. First thing, before I start sharing my slides, when I do that, it's going to essentially fill what you can see. At the top right, you'll have a little sort of set of buttons. You can probably see 3 dots. You can use that to flick between the view of the space and the slides and such. So as a quick sound test, if everybody just presses Z on their keyboard, you'll do a little dance. So just to check everyone can hear me. That's good. We've got some boogieing going on. Love it. Okay, and then a little sight test just to check you can see me. If you all press F, it goes a bit loud, so watch your ears. Press F. There we go. Lovely stuff. All right. Here we go. So yeah, hello, a very big welcome to MonsterComm. I am Carl, the CEO of Word Monster, and I will be your host for this morning's entertainment and this afternoon's entertainment if you're able to stick around, but not this evening's entertainment, unfortunately. You'll have to go it alone from there onwards. We've got some fantastic talks and experiences lined up for you today, and I hope you enjoy connecting and chatting with people from the comfort of your own sofas or wherever you happen to be. I want to start by thanking everyone in our team who has been involved in putting this event together. It has taken over 6 months of planning. A lot of hard work has gone into creating the space, thinking about how we're going to run things. So thank you, team. You are the best. So I'm sure that since we're in the sort of the medical writing field, that there are some scientists among us. And as you know, scientists love experiments. So you'll be happy to know that you're in one. We've been using this platform since January of this year. We use it daily as our virtual office, but this is the very first time that we've put on a proper conference like this for quite as many people. So you can really think of yourselves as pioneers, the first people to attend an event like this in healthcare comms. We're not expecting any fire drills this afternoon, so you can kick back, relax, and put your feet up. Right then, so some things worth you knowing about. You can see me, but I can't see you. You're going to be able to see the other speakers when they come up to the microphones. Since you're in the audience listening to this, you should already be familiar with moving yourself around with the arrow keys. You can also use the W, A, S, and D keys to move about if you're a lefty or if you'd like to. You can control your microphone and video by clicking on these little symbols here. But we'd ask you to keep your cameras and mics off just for the talks so that we can maximize bandwidth. But feel free to use the emotes to react to the talks if you'd like to. Later on, when you're exploring the area, you can press X to interact with things. You might have already noticed that when you've been crossing things that are interactable, such as the booths. And if you get stuck behind somebody in a doorway or something like that, rather than pushing them out of the way, you can press G to hold down G, and you essentially ghost through them. You'll know you're doing it right because you turn transparent and just walk through them. F and Z, you're now already pros with after that little demo, and I've already pointed out the sort of top right thing to change your menus. Very last thing, there's a little sort of share screen symbol. Unless you're a speaker, please do not click that little share button. Otherwise, you'll be sharing it amongst the people that you can see in your little row, which is a private space for you. So if we do have a little comfort break mid talks, if you want to flick your cameras and microphones on at that point, you can say hello to the people next to you. Excellent. All right. So a little bit of netiquette. As I've said, during the talks, keep your microphones and cameras off for the bandwidth. Please don't use the blur or background features on the videos because it has some sort of lag or buffering issues. If you do have it on and you're noticing that for some reason you're not able to talk to someone clearly, if you turn that off, that should improve it. You'll be able to ask our speakers questions during the Q&A session, which is directly after the talks. I'll give you the lowdown of how that's going to work in a second. Any questions that don't get answered, you can come and talk to everyone at the booths. That's what this is all about today, networking, having chats. So yeah, please explore the amazing space this afternoon. You'll find your mini-map in your welcome pack, and so much of the space is interactive. So press After the talk, press all the buttons, race the go-karts around the outside space, and go and see if you can find some of our pets. Just to let you know about the pets, they're very, very loyal. So if you do pet them, they're going to keep following you until you leave the room. There's no way to sort of get them to stop. Any questions or queries throughout the day at all, you will have heard Cal chatting, but if you spot any of our event staff, we're going to be wearing our Word Monster purple, and they've got staff written in their name. So just wander up to them and they can sort you out. So here is our lineup for talks today. First of all, after this little housekeeping part, I'm going to give it talking to you, and look at this, I'm even wearing a shirt. That doesn't happen much these days. Next up, we've got our head of Monster Academy, Caroline, who will be talking about filling the resource void in our industry and how she's going about training the next generation of medical writers. Then we have Molly from Flexa, who's going to tell us about the importance of flexibility at work. And we will close our session with Stephanie, who will talk to us about engaging people through gaming to the benefit of healthcare professionals and patients. With the questions at the end, there are two ways that you're going to be able to, well, there are two ways that you're going to be able to ask questions to the speakers. You can submit them via the chat. There's a little Q&A thing at the bottom right. Pop your questions in there, and as I said, we'll try and get through as many as you can. Or if we don't answer them, just come and ask them again live at the booths. After our talks, it's over to you. You will be able to meet our speakers and our sponsors in the main hall. And yeah, really encourage you to go and explore the space. You can come along to some or all of our planned experiences afterwards. And we have quite a few. We have our office tours leaving from the main hall at 1 p.m. We're going to be meeting by the MonsterComm logo, which is just below the booth area. So if you gather there around 1, we'll then be able to take you across to our office and show you how we're using that. We have a VR meeting experience, which is kicking off at 1:30 in the VR hall. Those places weren't open earlier on, so you weren't able to go in them, but straight after the talks, they're going to be open. And essentially in here, if you wander in and if you go up to one of these computers, they're all connected to a link which will take you to the VR experience, so you can have a chat with our team there. Finally, if you like prizes, please do come and join our treasure hunt, which is starting at 2:15 up on the rooftop. We couldn't do a virtual event without having some kind of fun game. And there's a chance to win your very own VR headset as the first prize who completes it first of all. The way it's going to work is clues are going to be placed all over MonsterComm Arena. They could be in any of the rooms, and you're going to have to solve science puzzles to put together the password. Excuse me. The password for the door to the treasure. So very good luck with that. So just to touch on how the booth exhibition is going to work, each booth is a private space. That's the cool thing about this whole platform is when you're in the main lobby, you have to be sort of a certain distance. You have to be close enough to hear them, but once you're inside a personal, inside a private space, anyone in that space can hear you. You'll know you're in one with the sort of shadow areas, so they're all over, and you probably will have noticed them already. If nobody happens to be standing at their booth later on, they are linked to something that everyone would like to show you. So please do click X on that, take a look at the content there. And now is the best time to thank our sponsors, because without them, we wouldn't have been able to put on such a great show today. So just to introduce them very briefly, Inner Circle is a company that embeds center points into pharma companies and healthcare agencies. They support with all things account management. So go over, have a chat with them. Leave Dates is the best, simplest annual leave software that I've ever seen. You can forget spreadsheets or clunky inbuilt HR tools. We use it ourselves. It's brilliant. Go and find Phil and the team for a chinwag. Open Audience are audience engagement experts with a range of pro pieces of event tech that they'd love to show you today. Leslie is an absolute legend. I'm sure you'll have a really interesting conversation. And last but not least, Traffic Studio is a design team specifically operating in the healthcare space. They can make your stuff look real nice. And Yuri will be able to show you all about that. So a very quick run through of the space. You will be familiar as you will have entered through the tutorial zone. And then I think we've got actually next slide. Yes, so we have the coffee area. If you haven't poked your head in here, have a little look later on. A good place just to kick back and have a chat. This is our game room where you can chill out, have some fun with each other, play some games. We've got things like Scribble, poker, all sorts. Definitely check that out. One thing, I'm just going to go back. One thing I was going to say actually was you should pay extra attention to the next slides here. This is the only time that I'm going to mention it. There is in fact an Easter egg hidden somewhere in MonsterComm. And that is the only thing that we're going to be telling you about that. This is our main auditorium, which we're using for the talks. Hopefully everyone's got a great view and you can see and it's all working great. This is what our outdoor space looks like. Perfect for wandering around while eating your lunch today on a park bench. And yeah, we've got an expansive green park, go-karts to race on, dogs to pet, and I think there's even a maze in there, something for everyone. In our VR experience room, you'll get to see what a VR meeting looks like. If you go up to one of the computers and hit X, follow the link, you'll be able to join Dave and the team. And they're going to be showing you what the room features are in Meta Horizons, the thing that we use for our own weekly and monthly meetings, and we use it for all sorts of ways. Dave's got a little presentation of where VR is headed as well. So if you're into VR and tech, that is definitely one not to miss. And here's our rooftop with a stunning skyline view. This is where we're going to be meeting for the start of the treasure hunt and finishing up afterwards for a cold beer, wine, or cup of tea, whatever floats your boat. Please do come along at the end of the day if you'd like to. We're just going to be hanging out once the treasure hunt's done. And I've sort of almost ruined the secret of the treasure hunt. So the observant among you may have already noticed something in the main foyer, and that is the treasure room. And this is where you'll need to run to once you've solved all the clues and cracked the password, ready to enter it to unlock the door. So once you're through the door with the password, if you click on that chest, it'll tell you what to do next. And that is the end of the housekeeping. So hopefully everyone's comfy. Thanks so much for joining us today. I really, really do hope that you enjoy the talks and the experiences. Right then, so now you know what's what, who's what, and where's what. It's time for me to move on to what I'd like to talk to you about today. And that is about remote working. But don't worry, because I'm not going to be telling you about how to use Zoom for video calls or about some apps you can use for messaging each other. What I am going to be talking to you about is how you can build an emphatically positive company culture and how you can connect people virtually in deep and meaningful ways. Because I believe that you can create bonds with people that last a lifetime, with people you haven't met and may never meet in person. Before we get into that, just a little bit of reflection on why you might be here today. If there are any of these reasons, I think it's a very, very good reason to have come along. It could be to be gathering insights on how to develop culture and optimize your own remote or hybrid working styles. Is it to suss out how to attract more people and talent to your own team or company? Could it be to better understand how to embrace and implement first-class flexible working initiatives? Or do you want to help transform the industry and to challenge the way things have been done previously, looking for better ways to approach things? Or is it just to experience what a virtual 2D conference feels like with a view to utilizing this tech for your own teams or clients? And you should leave today with answers to these questions. Now, let me tell you a little bit about why we are here today putting on this event. We want to make our industry, medical communications or healthcare communications or pharma communications, whatever you'd like to call it really, the kind of place that we want to be. We want to showcase the latest and greatest in digital tools and tech to engage people, from the people we work alongside to healthcare professionals to patients. And we want to attract and retain the best talent in the industry, not just for ourselves, but for other companies in the medcoms industry too. And by doing so, raising the talent bar in the industry itself. We want to provide insights on what people want when it comes to flexibility in their working lives And to achieve this, we want to share ideas and best practices so that you can take them forwards in your own ways. So, how did I get here to where we are today? To start this story, we need to step back in time to those office-based days, or office-based only days, I should say, if you remember those. In 2009, I started a PhD in biomedical sciences in warm, sunny Aberdeen. I spent 4 years working on a drug target for type 2 diabetes. Despite loving the lab itself, the academic career path, it just wasn't the one I wanted. And so, like many people before me, I stumbled upon medical writing. And 2013 was then my first step into a career as a medical writer. I worked for a cool little company called Porthouse Medical in Reading, doing medical affairs and med ed. It was great, superb people, brilliant training, but the traffic into work was a nightmare. What was just under a 20-minute journey took over an hour every day, twice a day. And as I honed my medical writing skills, I found the office environment increasingly distracting. I was constantly reaching for my earphones to sort of try and listen to things to block out the noise. And I longed for my own space to work in, a bit like in episodes of the TV show Mad Men back in the 1960s, where they sort of had individual offices in the office, or some with two people in that sort of private space. This is the space I seeked, which could quite have simply been my own desk at home. I had the briefs, I had the internet, and at home I had the focus to produce wonderful words for my clients. How hard could it be? I thought. Really hard, it turned out. I mean, convincing anyone of the idea of working from home was impossible back then. I think before COVID, only around 4% of companies offered any kind of remote working. And that led me to moving companies to a creative digital healthcare agency called Big Pink, this time in Windsor. Again, brilliant people, fun office vibes. Everyone had Nerf guns. You had to be on like high alert all times for getting a shot. But it simply lacked freedom. And I had a 2-year-old daughter at that time. I wanted to be around to watch her grow up more than anything else. And so I set out to live life on my terms. Word Monster was born, and I intended to create a remote first company that worked for me and that would hopefully work for others who thought like me too. We started off supporting med-ed and creative agencies with their overflow medical writing projects. And as our team grew and our experience grew, so did our expertise and our range of services. But one thing has remained at the heart of our being, if you like, and that's our flexibility in how we work with our clients. We work with all kinds of clients of all different sizes in several ways, now supporting them far beyond medical writing with things like their own website SEO and social media, and even their own training of junior medical writers. We've kind of set out now to solve entire business challenges for our clients, helping them to build for the future, which takes me on to our mission, really, that underpins this whole event. And that is transforming healthcare communication support worldwide. And to me, this means a lot of different things. It means producing the best communications possible through having the best people, which is ultimately of benefit to patients. And this all starts with transforming culture from the way that we treat people with kindness and respect, from the freedom we offer people in how they work, giving them the autonomy to choose what works best for them. And that we also don't expect too much of people in terms of hours worked. And I think that especially in medcoms, you hear the phrase "it's just medcoms," and that for me just doesn't sit right. We also want to push the digital boundaries in healthcare and share our thoughts and knowledge with others in the industry, hence why we're here today. And we want to demonstrate that complete freedom and flexibility for people can work for your teams too. Um, Ultimately, we want to make the bedcoms industry a brilliant place to be so that people never want to leave. Fantastic people in medcoms, from medical writers to account directors, are hard to come by. But it hasn't really been like that for us. And it's all been thanks to the way we think. We're blessed with attracting brilliant people into our organization, people who want to join us on our mission to shape the industry. We've not once used a recruiter for hiring, for example. And While the remote working revolution had already begun before COVID, it's completely transformed what people are looking for and now expecting in their roles. This isn't the case for everybody, but so many people no longer want long commutes and being stuck in traffic. People don't want set hours. People want flexibility in how they work. And they want to take back control of their lives, being able to put life before work in some cases. And that's exactly what we've built. It's what we call our life first culture. The freedom to choose, the freedom to do great work, and to live a happy life and prioritize those moments in life that are important around getting something done. With good communication, setting expectations, it can truly be done, and you can have it all. But with working remotely comes isolation. That's something that people have, I've spoken to at length in the past. So how do we avoid feeling cut off from the world when working remotely? For me, working remotely doesn't mean just chatting on Teams. There's so much more that you can do that can enrich a culture, so much more you can do to engage people and to keep people feeling connected and build relationships with people remotely. I'm a massive gamer. I'm a massive gaming nerd. I grew up playing all the classics on the SNES, the Marios, the Zeldas, the PlayStation, the Xbox. And I got into PC gaming in my teens with a dodgy dial-up connection like the rest of us. And through these games, I made friends online, friendships that lasted years. And later on, when I was sort of 24, I invited one of my gaming friends to visit me. He came all the way over from Canada when we were in Aberdeen. He stayed with myself and my wife Jen, who you may have seen on reception this morning. And meeting in person was awesome. He stayed with us for about a week. And really, what this experience taught me was that you can develop really strong and meaningful, lasting relationships virtually without ever meeting people. But not just that, it also taught me the power of games behind building relationships. And this idea or theory about my own experience that I've been reflecting on has actually been proven. This is the case. A really interesting book written by a lady called Jane McGonigal called Reality is Broken talks about how playing games with others builds trust and improves cooperation. So knowing that you have someone's back in a pretend zombie apocalypse in a game sort of so elegantly translates back to the working environment where you're working on projects as a team, and especially in times when shit hits the fan. And so games are a large part of our culture, our relationship building, and I think one of the secrets to our success. Jane's also given an awesome TED talk about how gaming can make a better world, and yeah, I'd really highly recommend you check that out. And a sort of phrase that I'd coined was teams that play together stay together, and I think that's true. But it's not just all about games in the pure sense of playing some games with people for fun. There are loads of other places to find elements of gaming for connection across various digital tools. Virtual reality is one. It's great for simple conversations. Virtual offices, like the space we're on now, is another. Online whiteboards like Miro that you're probably familiar with if you've been collaborating, doing creative, workshops and such. Great for collaboration. And then there are games, things like Gartic, which is just a simple drawing game, a bit like Scribble that you can try out later. This is Sand, another game where you can draw landscapes out of sand, essentially. Very, very therapeutic. And there are loads of these types of games that you can try out in the game room today. So I'd say give it a whirl. And who knows, maybe you'll make a friend for life. VR itself adds a whole another dimension to remote working. When you're in a room together, it actually feels like you're together. You can explore worlds together. You can bond with people in ways beyond what's actually possible in the real world. You can watch shows together, all sorts. I won't say too much more about VR because you'll be seeing all of this later in our VR talk. at 1:30. But the applications of VR in the working environment are vast as well. And there are so many applications of VR with the kind of services that we do. Things like ad boards, brainstorming, VR podcasts. This is actually a screenshot that of me and Leslie in a podcast that we did. It was a pilot. It went really, really well. It was a really, really good use of VR. So things like talking heads videos, they're very, 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 very common in med affairs around events. They could be done in VR too. So how do we make digital work for us at WordMonster? Remote working has evolved for us and for everybody. We started on Skype. We started on Skype for our messaging, using the group chats as hubs for connection. It worked brilliantly for years, and Zoom became our go-to for video calls, which of course became hugely popular through COVID. We've now switched across to Teams for our kind of core business messaging and functions. We then trialed an app called Discord, and this lets you create sort of rooms that we gave names to. So we had things like the library, the open office, the help room. You can't see each other. When you're in the room, you can hear each other. And we tried creating, different places for different vibes and different work styles. But it didn't quite work because you couldn't see people. And I think not knowing what someone was up to meant you didn't want to sort of interrupt them. So it worked okay for a while. It was almost doing what we wanted, but it didn't quite hit the mark. But then more recently, we moved to Gather for our day-to-day office, and we have not looked back. This, coupled with virtual reality for our monthly meetings, is just working brilliantly to keep us connected and engaged. This is actually one of our VR team meetings. This is what it looks like when we all get together. People don't have to join in VR either. You can join as an external participant, which is how you'll be joining later. If you would like to, if you have a headset and you'd like to have a go with this, you can just let us know. We'd be happy to invite you into a room and we can have a cup of coffee with our VR headsets on. I've done that a few times now with clients and partners. It's worked brilliantly. In here, as you'll hear more about later, you can change the room layout so that you can present, you can have conference calls, breakout rooms, and you can even connect your computer so that you can access while in VR. So when you're in VR, you can see a computer that's in front of you, which is exactly what's on your real computer. And you can do this little pass-through thing, so you can see your keyboard. It's a little bit grainy, but you can still see where things are. So you can literally do normal computer work inside VR, and this is only getting better with the release of new headsets like the Apple one, which some of you may have seen recently. Just another example of a room simply hanging out in VR. It's great for just chucking on, having a one-to-one chat. It gives you something different, a different sort of vibe. The best part of it is that the audio is spatial, and what that means is that you can hear people who you're sat directly next to, so you can have private conversations, and the rooms actually have breakout rooms and such, so that they're designed for workshopping and then collaborating. Our office keeps us connected day to day. This is our main office. We have other rooms all over the place, portals that you kind of get lost in sometimes. But this is our core view, and yeah, really highly invite you to come along for a tour later on to check it out firsthand, and we can show you all the different rooms and how we use it. But just to go through a couple of the features, so everyone has their own desk. So when you're working, doing your normal work, you're sat at your desk. You can pop over to somebody else whenever you need them, and your camera can be off so that you don't get sort of interrupted or anything like that. And there's a little like dial tone. So if someone is AFK or they're not in the browser or the app, it just does a little ding dong, and then you can come and start a conversation. It's so brilliant for knowing what people are up to, where they are, so that you can engage them. You can go over to you can poke your head into a meeting if it's already going on and say, "Oh, hey Sarah, can I just pick your brain for 2 minutes? Someone's just asked me this." You can interrupt meetings. You can't do that on Zoom or Teams. It just gives you everything that feels like a real office. You get things like those water cooler moments when you pass people by, and you can have. I've already said about meetings. Yes, you can get together in rooms for meetings, and just knowing what people are up to is really helpful for collaboration, because you can pop in and join the conversation. You can invite guests. You can hold interviews. We've held interviews in here, and people have really enjoyed that platform. It's great to be able to have an interview with someone and give them a tour of your virtual office. What a cool thing to do. and you can bring clients into and show them about the space. Every space is customizable as well. You can change your avatar. You may have stumbled across that. So feel free to do that now while you're watching, or whenever you like. You can change what you look like. You can make it look professional, or you can choose like a zombie, or there are different sort of avatar characters. It's a little bit strange sometimes when Laura in our office is dressed as a gingerbread man. When she's sideways, you can't really see her because it's so thin. But have a play with all the different emotes. Give them a go. You can edit your name, as many of you have already done. If you do want to put where you're from today, feel free to add that on so that you can have conversations and people know what's what. And yeah, you can have specific rooms for specific teams or meetings as well. So we've got here a kind of co-working space. Great for if instead of being at your desk, you want to have a little chit chat while you're doing your work. And we even have a lunch area over here. And these trucks are linked to Uber Eats and Just Eat. So technically, you can order your food directly from the space and have it delivered to your door. It is pretty good. Oh, I think my headset just went off then. Can you still hear me okay? And importantly, it allows us to play games, from drawing games, chess and poker, to go-kart races. But it's not all about our own culture and our own team. There's a serious business case for spaces like this as well. Ways that we are using this, things like congresses like today. Congresses, large ones, you can have 500 people in a space and you can connect the spaces together. So you can have thousands of people crossing different places. For large businesses, you can have different spaces for different departments that can cross between each other and portal across. There is nothing that you can't do. Simple things like advisory board meetings, I think, are great use. Workshops, fantastic, and other events, training, things like that. You name it, this space is great for it. So what else can you do to keep connected while working apart? We have things like weekly wellbeing Wednesdays. We could be sat on the cushions having a chat about our mental health toolkits, things that can help us, or simply watching a TV show together. This is one that we jumped in VR just to watch something. But you don't have to have a VR headset to do all these things or to engage people like this. You know, there's an app for everything these days. The point is, there are so many ways that you can engage. Despite being a giant advocate for remote working, we do still love to meet up in person now and again, and we put on optional days for the team throughout the year, in addition to our 4 core social events. Here we were, I think one of these is last year, one of these is in Bristol. And I think it is important to have a element of human interaction, but they're optional. If people want to come along, they can. If they're busy or it's too far away, they don't have to come along, because remote first is the way that we approach it. Remote life certainly works for our team, and thanks to the new tools and tech, it is only getting better. Our approach to work is working. We're proud of our culture, and I hope that you've heard something amongst all of this that you can take through into your own team, company, organization. Together, let's shape the industry for the better. Thank you very much for listening to me. That is all from me for the moment. I will catch you a little bit later. Next up is Caroline, who is head of our Monster Academy, our medical writing training hub. So Caroline, please come up to the stage.
Hi, Carl. Thank you so much for that wonderful talk, and thank you, for everyone for being here today. Let me just share my screen. Just bear with me 1 second, just making sure I've got my screen set up okay. So thank you for coming and listening to this talk here. So I'm Caroline, and I'm going to be talking about filling the industry-wide medical writing void. So it's lovely to be here and see all these wonderful avatars in the audience, and what a great time it is to be in medcoms, right? So before I start, I'm just going to introduce myself and tell you a little bit about my background. So I'm Caroline. I'm a principal medical writer here at Word Monster. And let me start by explaining my monster name. So for those of you that don't know, at Word Monster, we all have monster names when we join the company. My monster name is Geneva. I chose this as we have a life first culture at Word Monster, as you've just heard from Carl. And as I started here, we had just been on a family holiday to Geneva in Switzerland. And I was making those special memories with my 2 girls and my husband. And my other love in life is genetics. And it was my first science passion and always will be. So my name combines my 2 passions together. As well as a passion for medical writing and communicating those complex scientific topics, I love all things education, and I'm now privileged to be in the position of training the next generation of medical writers and helping them succeed. So my screen has just changed a little bit. There we go. So my journey to this point has taken me through quite a windy path, yet very rewarding path. I started with my qualifications in biology. So I graduated with a master's in biology from Bath University. And I then went on to complete a PhD in medical genetics at the University of Birmingham. I also have a postgraduate diploma in education, and I am a qualified teacher. My first glimpse into the pharma industry was when I worked as an industrial placement year in a drug discovery and pharmacology department at a pharma company based in Reading. And it was, in fact, this placement that inspired me to go on complete a PhD. I also completed a postdoc at a protein diagnostic company, running retrospective clinical trials and managing a small research group. And more recently, I worked back at the same company as an MSL, or medical science liaison. I was drawn into the world of medical writing, which was clearly aided by my hatred of Western blots, which I'm sure lots of you here today would empathise with. Going on to writing experience, I actually first started medical writing for the NHS. I worked at the National Genetics Education Centre, creating slide decks, leaf pieces, video, animation, transcripts, as well as completing curricular gap analyses and running face-to-face training sessions. And when I worked as an MSL in the industry, I also had a joint role actually, where I worked in psychoms, gaining that vital experience in producing slide decks, manuscripts, etc., before moving over to writing in a medcoms agency here at Word Monster, where I've now been for 3.5 years. And finally, my experience in education. I did tell you this is a very windy path. But yeah, along the way, I've gained much experience in education, which is vital for my role today, working as a secondary school science teacher and as a biomedical lecturer. And now I get to combine my 2 passions, medical writing and education. So enough about me, onto what you really want to hear about today. So today I want to talk to you about the medical writing void. That is the lack of medical writers that we hear all about, and how here at Monster Academy we're trying to help solve this problem. I'm going to start by discussing what is causing this void, and then go on to discuss the importance of training and what impactful training looks like, and touch on some of the insights that we've gained from creating the Monster Academy. So firstly, let's start by taking a moment to think about the history of medical writing. So we use Slido a lot in training here at WordMonster. It's super simple. If you haven't used it before, you just need to grab your mobile phone and scan in this QR code. And once you've done that, you should be able to answer the question. So how long has medical writing been around? So 6000 BC, 1827, 1990s, or 2007. Just a couple more minutes to answer that. So I'm wondering if some of you have been in any of my talks before, because yeah, a lot of you got that right. So 1827 was in fact my red herring. So the roots of the pharma industry date back to the apothecaries and the pharmacists of the Middle Ages. And in fact, 1827 was when the first pharma company started trading. That was Merck. 1990s, perhaps, the rise of the medical writing industry, of the World Wide Web. And yeah, no one picked 2007. And in fact, majority of you are correct, that the medical writing can be dated back to 6000 BC. So you may think of medical writing as a fairly new career, supporting pharma and portraying the use of modern medicine, but we can think again. The first record of medical writing actually dates back to the ancient past, with a mythical god, Thor, a god who worshipped in Egypt between about 6000 BC, and first documented the use of medicine on the body and diseases on papyrus rolls. In fact, medical writing can be followed through history, from the Hippocrates of Cos to the great Roman medical scholar Galen. And it's also important to mention the New England Journal of Medicine, which was founded in 1812. And this is the oldest continuous medical periodical, which is central to the rigorous peer review process that holds writing and publications to a high scientific accuracy and a stringent editing process. And here we are in 2023, sat at MonsterComm. So what's next for medical writing and medcoms? Well, the future is very exciting. It is an industry in growth. It's expected to be a surge in the demand for medical writers over the next decade, with the medical writing industry set to more than double from 4 billion to 9.4 billion by 2023. What a time to work in this industry, right? So why is medical writing expanding? So let's start by looking at pharma itself and the expanding landscape of pharma. So the pharma industry has witnessed tremendous growth over the last decade, with COVID-19 further fueling the development of potential treatments, diagnostics, and vaccines at an unprecedented rate. There are now over 5,000 companies involved in pharma research and development globally, approximately double of that was in 2012. The global pharma R&D spending has increased from about 130 billion in 2012 to over 240 billion in 2022, this leading to an astonishing doubling of the pipeline drug count. And the swift pharma growth of pharma R&D has in turn accelerated the growth of several other associated industries, including medical writing. The global medical writing market stood at a value of approximately 3.8 billion in 2022, and the industry is further anticipated to grow at a compound annual growth rate of over 10% between now and 2030. And as we saw on the last slide, this means the medical writing industry is set to more than double from that 4 billion to 9.4 billion in 2032. So as we've seen, the demand for medical writing is growing. But there's more to it than just the growth of pharma alone. There are many other factors which are accounting for the growth in medical writing demand. There is a focus on evidence-based medicine and clinical research, and with this comes a need for communications to cover all aspects of writing clinical publications to an increased need for medical education. There is an increased demand for regulatory writing. So there's an increased demand for trials, which are becoming more complex, and with this, the increased demand for regulatory writers. There is an ever-increasing emphasis on pharmacovigilance. A stronger focus on patient safety and pharmacovigilance over the years is clearly pivotal, and this has led to larger requirements for writers to make safety-related documents like adverse events reports and risk management plans. And of course, the digital revolution has well and truly hit pharma. The way we interact with health information has changed. According to a study in 2018, around 80% of internet users in the US searched online for health-related information. In addition, at least 60% of social media users rely on health information posted on social media platforms. So in recent years, the pharmaceutical companies have adapted their advertising strategies to improve patient outreach. In addition, the growing influence of social media on customers' decisions has compelled pharmaceutical and biotech companies to reconsider their marketing strategies. And this is not to mention the trends in MedEd with increasing need for content such as mobile apps, web platforms, and e-learning courses to reach out and train healthcare professionals and internal pharma employees alike. And last but not least is the rising outsourcing of medical writing services to specialist agencies. So outsourcing medical writing assignments lowers the staffing need by lowering the cost of recruitment, training, and retention. And medical device and pharmaceutical companies are increasingly turning to outside vendors to meet their writing need. Hence, the demand for medical writers is growing in agencies such as ours. So what's the solution to this ever-increasing need for medical writers? It's to hire more writers, right? Seems simple, and I can nearly hear all of you say this. If only it was that simple. So we all know there is this need for more medical writers. There's also a load of graduates trying to break into the industry. So what is the problem? Medical writing is a niche role, and for that, you need to have a specific skill set and training. So unless you're a handful of companies lucky enough to have great training schemes, just employing more writers is not the answer. So as I said, working in medcoms is a niche career, and the skills required to be a medical writer are diverse and specific. There is a shortage of people with a particular combination of skills needed to be a successful writer. There are so many niche skills, from those with class as key attributes, such as attention to detail, interpersonal skills, creativity, to scientific skills, having that scientific knowledge and the ability to critically analyze data and studies, and know the relevant guidelines, to the all-important language skills, and medical writers must have impeccable English, and finally to those transferable skills of agency skills and soft skills and project management that are also really key. And there are even more aspects to being a great medical writer than just those skills we've discussed so far. There are a vast variety of documents that medical writers work on. And these are just some of the examples shown on the screen here, from medical education, such as like producing slide decks and e-learning, to regulatory writing, to healthcare, copywriting and advertising, writing for a lay audience, and to making sure that you have SEO-driven content. How many times have you seen a CV land in your inbox to review, and it's from an academic, a highly intelligent, skilled, articulated individual with a dire need to break into the medical writing industry? But with all due respect to these individuals, they don't realise they do not have the skills they need, not just yet. Even if they are going to specialise in publications, the world of pharma is very different to an academic life. Do they know the stakeholders they are going to interact with? How to adapt their writing to the tone for the right audience? The recent requirements in GPP4, or the Good Publication Practice Guidelines, for example, or know how to produce really accurate and detailed lay summaries. And this is only if they want to focus on publications. This means there is a demand for mid-rate medical writers who are fully trained, causing more turmoil in recruitment and headhunting for experienced medical writers, and limited opening for entry-level medical writers wanting to join the industry. Furthermore, we have very experienced writers who then go on to become freelancers, adding fuel to the fire. So what is at risk if we don't have these skilled and trained medical writers? Quality, reputation, and compliance is at risk. Okay, so I might be a little bit harsh with the image I've used in this slide, but there is a growing problem in our industry. For those of you in the audience who are not British, here is your homework to research this British classic, which epitomizes the term rogue trader. As I say, I am being a little harsh here, but we do need to protect our industry. We work in one of the most heavily regulated industries out there, and it's for a very good reason. When we get it wrong, the consequences are huge, and we need to protect people and patients from harm. We need to ensure that medical writers have the training they need. Training in soft skills, in writing skills, how to interpret statistics, how to write for different audiences, the lists go on. But I think training compliance is really top of the list. Understanding the APPI code, as well as codes for other regions, is vital to ensure the breaches are not made and we do not tarnish the pharma industry and pharma companies' reputations ultimately as well. So, you know, making sure we have this trust in the industry. You may have spotted the phrase there in my word cloud of inexperienced freelancers. With the increased demand for medical writing, coupled with this lack of opening positions, more and more individuals are turning to careers in freelance medical writing with little or no industry experience. And like other agencies, freelancers are key to the growth and stability of our company. We couldn't be without them. And a big shout out to all freelancers out there too, who are experienced, professional, and produce incredibly high quality work. But how do we ensure we have these high quality freelancers in our team? Like all agencies, we ask freelancers to approach us to complete a writing test. And so often, freelancers not only don't pass a writing test, but some don't even come close. And these are very able individuals. They just don't yet have the skills or the experience. So we really need to think about how we can train up more medical writers to make sure we do have this quality and make sure we keep the high standards of our industry. So what is the solution? Train more writers? There are lots of enthusiastic graduates and career changers trying to break into medcoms. And I think we're actually absolutely right here. We need to train more writers, and training programs are absolutely pivotal at the moment to make sure we close this void in the medical writing industry. Training is a very powerful tool for success, both for individuals, agencies, and the industry as a whole. Training is really vital for all individuals working in medcoms. Training ensures that employees feel valued. They are improving themselves, and career progression opportunities are increasing for them. We are improving skills and closing that skills gaps and we improve and increase motivation in individuals when we have more training available to us. Training is also a really powerful tool for success for agencies. It helps us ensure we have that really high quality work and instills a really positive work culture in our own companies. And for the industry as a whole, training is vital. Training upholds the trust in the industry, which is in fact the second clause in the ABPI and one of the most important overarching requirements of our industry. And I'm just going to take a moment here to focus on agencies and pharma, and because I feel this is really important. And it's a really, really important benefit to providing valuable training. This is that quality training is heavily linked to employee retention and recruitment. Having discussed at length the shortage of medical writers, you want to make sure that you nurture those that you do employ, that you have invested so heavily in already. And here are some really noteworthy numbers. Companies that excel in training and development have been shown to retain employees for twice as long as companies who invested in less training. A recent LinkedIn survey showed that 94% of employees say they would stay in a company longer if they invest in learning and development. 74% of workers are willing to learn new skills to remain employable. The number repeats itself. 74% of workers feel they aren't reaching their potential due to a lack of training opportunities. In 2019, a study published by the Harvard Business Publishing showed that more than 55% of employees consider career growth more important than salary. And Amazon actually published some stats in 2021 indicating that 66% of workers aged 18 to 24 ranked learning as one of the most crucial perks when choosing new career opportunities. And finally, the tech company IBM found that employees who feel they can't achieve their career goals are 12 times more likely to leave a company. So with all that in mind, we have seen the importance of training to individuals, to agencies, to the industry as a whole. I want you to take your mind back to when you first entered medcoms. Whether you had great training or poor training, what I'd like you to do is think about one word that describes your training as you entered medcoms. Again, you just open the browser that you used last time. This should pop up automatically, or just re-scan this code here and it should take you to the page. And yeah, I just want you to think of one word that can describe your training as you entered medcoms. Some great answers coming in here. Thank you to everyone who is contributing this. It's really fantastic. Yeah, as you can see, the largest in the middle there is lacking and minimal and learn as you go, which is really, really interesting because there is this massive lack of training. It is not just the case, there are some great positive answers here as well: comprehensive, deeper end, valuable, necessary, really important. Generous, which is great, task orientated. But yeah, we have got, I'd say, hedging more on the side of negative points, I would say there. So occasional, compliance only. I guess compliance is really key. So it's great you're getting compliance, but there's so much more. Ad hoc, sporadic, sparse, poor. Thank you for that input. It is really interesting to see. And with that, let's move on to look at impactful training for medical writers. So what does a successful training program look like? It seems like there's a few of us in the audience who may have taken part in these when they joined MedComms, and maybe there's more of us who haven't. So a successful training program may be a graduate training program, and several of the larger medical writing companies now have developed their own programs, which is great for those that are working for these industries, for these companies rather. And what would be really great is if, and I think some of the companies do have this, is in-house training and mentoring to align with core competencies to aid in helping medical writers progress their career. So it's not just the entry-level training, but also training as you progress from medical writer to senior writer to principal writer. So a whole package of training that supports all aspects of your job is what is really needed. What I think is really key is that we ensure that training is developed and delivered by qualified trainers who know how to get the most out of training. And also an effective learning management system is also really key. So this is software or web-based technology to house and monitor the uptake of training. But the question is, what happens if you don't have the time, the resources, or the capacity to create such training programs? Screening, testing, interviewing of medical writers alone takes up really precious internal time and resources. And the development of new writers relies on already stretched senior team members to provide ongoing mentoring and supporting these more junior writers. So what do you do if you don't have the time for this? So here we are trying to help. And let me introduce to you Tooth's doppelganger, who funds the Monster Academy. Our mission, we want to fill the medical writing void. We want to improve our industry for the better by offering high quality training. And indeed, we want to train 5,000 plus medical writers over the next 5 years. We have developed an extensive curricula of training. We are supporting entry-level medical writers up to senior level and beyond. We partner with individuals to build careers. We offer training programs that offer the foundation to a career in medical writing, helping graduates and career changers get their foot through that door. We partner with agencies to build teams. We become their training partners and with our clients, and we empower our partners to create their own graduate training programs and continued career development by providing the curriculum to train these entry-level medical writers and support them as they progress in their career. We also partner with pharma to build expertise. Many pharma are now building their own internal medical writing teams, as well as outsourcing, and we support building skills and training here too. And in fact, we are currently working on one of the top 5 pharma companies to do just this. So what are these services we offer? We offer the whole package. We offer consultancy services, so we can help build that knowledge and those services from team mapping and core competencies to providing top-notch style guides, for example. So for agencies and for pharma, we're really helping build those teams with our consultancy services. We actually offer the whole package. We offer talent acquisition as well, so we can do the hard work to build teams from the bottom up. We have the platforms to attract, filter, and hire great medical writers. I guess maybe the most important part is the training workshops and programs that we offer. So medical writer training has been created especially for these healthcare writing teams to cover everything from promotional copywriting to quality control and data checking. We have it all covered. And Monster mentoring, upskilling teams with focused training and coaching to make sure that we support medical writers through their whole career as they progress. So to summarise, we have all bases covered. We are determined and we are going to upskill medical writers and close this medical writing void. So for the last few minutes of my presentation, if you can stick with me for a little bit longer, I'd like to share with you some of the insights that we've gained during this process of creating our own Monster Academy. So firstly, the extensive time it has taken to create the Monster Academy. We have spent a monumental amount of time developing content for this course. It is not a curriculum that can be developed overnight, but it takes years, and it is a continuous process. We are constantly reevaluating and updating or adding new content to the training that we deliver. And secondly, we have all heard the phrase, it takes a village to raise a child. Well, it takes a whole team of medical writers to create an academy like this. And as a true medical writer, I'd like to substantiate all my claims, and being a parent to 2 children, I can very much testify that it does take a village to raise a child. In fact, I think that's a bit of an underestimate, and I think maybe a city would be more accurate, I think, in my case, and I'm sure many of you here might agree. And I can also testify that it very much does take a whole team to pull this together. As a team, we have got over 100 years collective experience in medcoms, and this deep expertise and teamwork has been everything and pulling together the amazing curricula that we now have. And moving on to digital solutions. We all heard from Carl earlier, and we are very proud to be a fully remote company at WordMonster, and our training academy is no different. But with that in mind come some challenges. We needed to create a remote course, but luckily technology these days is on our side. So let's start with the learning management system. There are loads of course platforms out there, all with their own benefits. We did our research and we found that LearnWorlds was our match. LearnWorlds is a cloud-based platform for online courses, allowing us to host both external courses and our own internal training. Not only do we host courses via this platform, but it also allowed us to build a completely customizable website based around it in this platform. It also allows you to create a community for people attending the courses. They can chat to each other within the platform. When they log in, they can see all of the content and they can chat to each other and they can ask questions to us, and communication is really fantastic. As with any quality learning management system, it has great features for reports and analytics. And of course, course assessment is absolutely key to a good training package. You can track engagement and monitor trainee progress. So you can even see who's been engaging with different videos, and it provides you heat maps even to show you which parts of certain videos people rewatch several times. It is really quite amazing amount of detail you can get out of the platform. LearnWorlds pairs very smoothly with Zoom, in fact. And so our course uses Zoom as well. And of course, we are all familiar with Zoom during the pandemic, but don't worry, there are no more quizzes that are going to happen through Zoom here. But I have to say it is great. Users don't even need to log into Zoom separately. They can attend live webinars through logging into their LearnWorlds platforms. They have everything in the same place, and they attend the webinar through Zoom in this browser. The next challenge we faced was making learning engaging and getting that formative and summative assessment that is so key to all of us trainers. And this is where Slido comes in. And as you've seen Slido in action today, it really is a great polling tool to use, and it does add that magic sparkle to our webinars, so you can really keep engagement and also make sure people are following your training, and also just adding that extra level of engagement as well. And last but not least is Articulate. I have to say we have had great success with our synchronous training programs, where we run weekly webinars, as well as other writing tasks as well. But we're now looking at developing an asynchronous training that is purely e-learnings, where users can really access the training at their own pace and at times that suits them, so don't need to even attend live webinars. And this is where Articulate, in my opinion, is the best software out there for creating these interactive online e-learning modules. And they have also themselves, Articulate, have recently pushed forward with their options for creating micro learning too, which is really fantastic. So hopefully this has given you a really good snapshot into the digital solutions that we are using at the Monster Academy. And finally, I just want to relay to you the benefits of remote learning. I was already convinced of remote learning. I think it's amazing, but the benefits of remote learning and how they fit into our world today is really fantastic. And I just want to run through some of those with you now. The first is learning is interactive and dynamic. Gone are the days of remote, boring online lessons, but now the possibilities to engage are countless, from interactive breakout rooms to Slido. All sorts are now possible. Remote learning, as with face-to-face, still allows a strong curriculum to be built around andragogy or adult learning theory to ensure the most effective training is developed. And all important, training fits around life. As we said, Word Monster is a life-first company, and our training is no different. And the final point that I have to say still blows my mind some days is that we really can reach people worldwide. And we are so proud that we are not only closing the medical writing void here in the UK, but we are reaching as far as the US, Hungary, Norway, Australia. Literally nowhere is out of bounds. So to summarise, and thank you for staying with me so long, the industry is facing exponential growth. It is a very exciting time to be working in medcoms and medical writing, and there is very much a great growth. But with this, the skills gap is worsening, and we need more medical writers that are trained, that have the expertise. And here at Monster Academy, we are filling that resource void. We are going to train 5,000 medical writers over the next 5 years. So thank you so much for listening to my talk. I hope it's given you some of the insight into how we've been developing the Monster Academy and how we're hoping to close this void and train up more medical writers. If you would like to know more information, please come along and talk to me at the Monster Academy booth, or grab me anywhere in the Gather platform for the rest of the day. And please also head over to our Monster Academy website and follow us on social media. I have left those 2 QR codes there, but please do come and find me as well. Thank you very much. And with that, I will hand over to Stephanie, or Molly. Sorry, I'm not sure. I think it's Molly next. Sorry, Carl.
Thank you so much, Caroline. Brilliant talk. Thanks, everybody. Yeah, so Molly is on her way. She's going to be arriving at 11:20. So what we'll do is we'll have a very quick comfort break, top your tea up, grab a coffee, and in the meantime, feel free to turn your mics and your Zoom and your cameras on, have a chat amongst yourselves. That's what it's all about. So yeah, we'll be back with the talk as soon as Molly's here. Should be 5 minutes. Thank you all. Hello, welcome in, Molly. Everybody, if you're still chatting amongst yourselves, if you could switch back to turning your microphones and video off. Thanks for joining a little bit early, Molly. Appreciate it. So yeah, just to introduce Molly, she's CEO and co-founder at Flexa Careers, who is on a mission to enable flexible working across the globe. So yeah, take it away.
Thank you very much for having me, and hi everyone. Very nice to be speaking to you all today. So yeah, I'm going to be talking all about flexible working. Let me share my screen briefly so you can see what I'm actually talking about. So obviously, Word Monster, very, very flexible company. And this is obviously why Carl asked me to come and speak about flexible working, because it's a topic close to his heart. So I personally believe that flexible working is the future. But first of all, I will introduce myself. So I'm the CEO and co-founder of Flexa, as Carl said, and we are the global directory of verified flexible companies. What that means is we enable people to search by how they want to work, as well as what they want to do. But I'll go into that a little bit more in a second. Wanted to start with my story and why I'm here talking today about flexible working. So I have had an autoimmune disease since I was about 18, which means that sometimes I can't walk, my feet swell up, my hands swell up, my face swells up. So obviously not great for trying to get into an office. But regardless of that, back when I left university, I went straight into investment banking, which is not the most notoriously flexible career I could have chosen. But at the time, I just really wanted to do it. God knows why, looking back on it now. But I kind of struggled through for about 2 years. I was wearing slippers to try and get into the office, putting like tea towels in my shoes to pad them out better, having to take pictures of my swollen feet and face in order to justify being able to have a day off to be able to go to the hospital to get checked out. So it's pretty miserable. And after about 2 years, they said, well, we're open to flexible working requests, so you can put one in if you want. I was like, great. Didn't really know what one of those was because I was about 23. And put a flexible working request in because I was sent to an occupational health therapist who actually said that I should be registered disabled to stop me from discrimination. And he helped me put in that request to work from home 1 day a week. And 10 days after I put that request in, they put a settlement package in front of me, sacked me, and told me to leave immediately. So they obviously not open to flexible working. I then went into the job hunting market, and granted, this was kind of back in 2016 when flexible working was a little bit less normal. But I realized that there was such a terrible lack of transparency in the hiring process. Basically, impossible to be able to understand what it's like to work at a company before you join. And for people like me with disabilities, or women who have caring responsibilities, or people of different sexual orientations and ethnicities who naturally will err more towards wanting to work flexibly because of the microaggressions that they will experience in offices. Sadly, we still live in a world where that happens. We all want to understand exactly what it's like to work at a company, because not every company's working environment will be right for us, which is where the idea for Flexa came along. So we launched Flexa 3 weeks before the pandemic hit, which is a very strange time, fortuitous in the end, but was a strange time to launch a business focused on flexible working. Now, if we look back pre-pandemic, around 30% of the global office population said that flexible working was a non-negotiable. That was around 100 million people all over the world. Fast forward through to now, post-pandemic, and around 80% of the global office population say that flexibility is a non-negotiable, and 92% say that they would like it. So the demand for flexibility has now gone to over 300 million people all over the world. And I'm just focusing on traditionally office-based roles as well. I'm sure the demand for flexibility outside of that is even greater, but that's where we focus. So we decided to make it easy to discover genuinely flexible companies. Ultimately, if you've built flexibility in your company, you deserve to be discovered for it. But it's actually been impossible to search for companies that offer genuine flexibility. Actually, you can see 76% of the global population, exact stats there. But why does Flexa work? And ultimately, it's because we are marketing flexible companies to the world. We get flexible companies discovered for all of the hard work that they've done, and we recognize it with our flexibility certification, which is where I wanted to give Word Monster a shout out. So Word Monster have been with Flexa for a couple of years now, and Carl's actually one of our investors too. And they have had our Flexa seal of approval for a couple of years with an amazing Flex score of 95. And what that means is we have taken internal feedback from every company that we work with. An anonymous quantitative survey goes out to all companies, and their employees give us their anonymous feedback on their different experiences of flexibility. And we've done loads of studies around what actually is flexible working, because I'm sure we've all seen open to flexible working at the bottom of a job description and thought, God, I don't really know what that is. What does that mean? And so we've tried to codify and demystify what flexible working actually is. And through numerous studies, we have now come to understand that flexible working is pretty much made up of around 6 different factors. The first 3 are kind of obvious. So location flexibility, hours flexibility, and benefits that will add to flexibility. That could be enhanced parental leave or work from anywhere schemes, dog-friendly offices, for example. And then there's 3 cultural indicators. So that is trust and autonomy. You know, are you trusted to get your job done in the right way that works for you? Do you have work-life balance? You know, whatever that might mean to you. Everyone's version of it is different. And finally, our senior leadership role modeling flexibility, because it's very difficult to embrace flexibility if your senior leaders are not advocating for it and supporting it as well. So WordMonster scored brilliantly across all of those 6 different areas, and came out with a 95% flex score, which is how we rank all of our companies as well. So I'll go into more detail as to what people mean by flexible working. Obviously, I talked about that kind of codifying flexibility and trying to understand it from a quantitative perspective. But it really does ebb and flow as to what people are searching for when it comes to flexible working. So I'll give you a little bit of a data rundown of what we see as like a 3-month rolling average at the moment, because we've seen all sorts of trends emerge over the last 3 years. We've gone through fully remote being the hands down winner in terms of popularity, to remote first, the choice of an office suddenly winning. We've had work from anywhere schemes rise in popularity pretty much every summer. And actually that is still the case. So I thought it would be useful to share what potential prospective employees and obviously current employees as well are searching for the most. Like, what kind of flexibility do they really want? So I'll start with location. So this is a 3-month rolling average based on millions of different data points that we collect at Flexa, because we've got over 1.5 million users now, conducting around 150,000 searches every single month. So got loads and loads of different data points to be able to rely on. And we're growing by about 100,000 new users every single month. So demand for flexible working is clearly very strong. Location-wise, fully remote is the winner. Always is every summer. I think people just want to be able to go away when it's hot and kind of have a bit more freedom. So around 50% of people are searching for a fully remote company. But demand massively outstrips supply, as we've now seen the supply of fully remote working dip to around 20%. So obviously companies like WordMonster that are fully remote have a very large selection of talent to be able to choose from. Remote first, where there's the choice of an office with maybe infrequent meeting cadence. So like, we're remote first at Flexa, we meet once a month. Demand for that is around 38%, so very close to fully remote as well. And then the remaining balance there is for hybrid. So we still have hundreds of thousands of people searching for hybrid. I feel like it often gets a bad rep in the world of flexibility, but actually going into an office a few times a week, a couple of times a week, is still in demand from hundreds of thousands of people, around 12% in fact. Time is obviously the kind of next biggest indicator of flexibility, I suppose. And around half of people want some form of hours flexibility. This obviously massively over indexes with women, because we still bear the burden of household and childcare responsibilities, sadly. Obviously flexible working can massively help with that. But people that are searching for fully flexible, so like totally asynchronous working times, is around 22% of people. Core hours, so like that could be working 10 till 4 or 11 till 3, around 12%, and just a little bit of flexibility, so half an hour, you know, bit more chilled as to when you come in, is the remaining balance of that 50%. And then a couple of other really big ones that we've started measuring now. So the evolved work week is a phrase that I use to try and encompass 9-day fortnights, 4-day weeks, 4.5-day weeks, and all variations of something that is not a 5-day week. 93% of people say that they would love an evolved work week, unsurprisingly. The most popular one is the 4-day week, where 49% of people have expressed an interest in that. 32% are saying they would like a 4.5-day week. We offer a 4.5-day week at Flexa and have done since inception. It's actually a very easy one to embrace because apparently, according to a lot of studies, people are not productive after 2:30 p.m. on a Friday on average. So you're basically just giving them some free time when they wouldn't have been doing anything anyway. And then finally, the 9-day fortnight, the slightly more creative version, around 13% of people say that they would have an interest in that. And then to summarize, what is flexible working with benefit side of things? The most popular benefits that we see being searched for that add to people's flexibility are work from anywhere schemes, being open to part-time employees, offering a work from home allowance, whether it's to be able to set yourself up with a home office or maybe go and work in a co-working space. And then mental health support and a wellbeing allowance as well all come up in the top 5. So that's a kind of brief rundown of what actually is flexibility. And then I suppose probably one of the most important questions is how can companies both embrace but also get the most out of flexible working? I'm sure lots of people listening here today already work in flexible environments, so I can talk to you about how to get the most out of that. But also, how do companies that maybe were forced into it through the pandemic and they're wondering what they should do afterwards still, how do you start to embrace that kind of flexibility? And my advice for companies that are still kind of on their flexibility journey is to start by looking at how you work now and make a minimum commitment to flexibility. That should be something that you're very comfortable with, that is happening culturally at the moment, whether that's 2 days a week from home or coming into the office 1 day a month. Remote and in-person work are fundamentally complementary, and it's up to every company to work out what their balance and cadence of in-person and remote is. Some companies will just meet up once a year or meet up virtually more often. So make that minimum commitment and then shout about it. So loads of employees say that they are feeling like they're in quite a precarious position when it comes to flexible working because their companies have not communicated to them exactly what their stance on it is. Obviously, this can lead to a lot of anxiety, not really knowing how you should behave. So I would urge every company to be super clear about your minimum commitment to location flexibility, hours flexibility, and benefits as well. And be super, super crystal clear on that. My second piece of advice is don't feel like just because you've made that minimum commitment now, that can never change. Ultimately, the future of work is constantly evolving. And the way that companies work is always being iterated upon, or it should be, because you want to be listening to employee feedback as to what they love, what they don't love. You want to be looking at key output metrics and productivity metrics to make sure that it's working for you. Because flexibility isn't just about giving flexibility to the individual. Obviously, that's a big part of it. But it's also about doing that within a framework that balances company culture and goals as well. You cannot have freedom without boundaries. So it's making sure that that is crystal clear to people and that that's constantly iterating in order to balance those two sides. They should ultimately go hand in hand rather than be opposing. And then my third piece of advice in terms of getting the most out of flexible working is shout about it. It should be, if you are a flexible company, it should be the central part of your employer brand. If you think about employer branding as the act of marketing your employer value proposition, the central part of your employer value proposition is flexible working. So shout about it in as many places as you can. Encourage people to share on LinkedIn their own personal stories. People love employee advocacy. It helps to bring company culture to life. And people ultimately believe people and stories much more than they do your careers page. Make sure that it's everywhere, careers pages, job descriptions, bottom of email signatures, anywhere that people would be likely to come across you in a job hunting capacity. And also make sure that it's part of your internal culture. Keep shouting about it, keep celebrating it. And of course, you can work with Flexa to be accredited and noticed and recognized as a genuinely flexible company and reap those rewards too. So that's kind of my summary on flexible working, what it is and how companies can embrace it, just like Word Monster have done. So if anyone has any questions, I will hand over.
Brilliant. Thank you so much, Molly. Are you able to hang around for the Q&A, or do you need to dive? otherwise, I can let people pop in questions now. If you have any questions for any of the speakers, please do use the Q&A feature. Anyway, we're going to collate them for the end session.
I can hang around, yep.
Okay, perfect. Well, in that case, we'll stick to the plan. Yeah, thanks so much, Molly. That's incredibly interesting. And yeah, everything you're doing around flexibility, we are so on board with. And yeah, great to see you having so much success. So yeah, if you pop back to the sofa, and I'd like to invite Stephanie up to have a chat. And just to introduce Stephanie briefly, she is CEO and founder at OKKO Health, who is helping to save the sight of millions of people across the world. That's a good intro. Over to you, Stephanie.
That is quite an intro. Carl, thank you so much for having me. You can see me okay up here? Yeah, thanks so much. It's really a pleasure to be with everybody here. And in such I think this is about the coolest conference I've ever been to. And I wanted to share with you what we're doing in my startup at OKKO, how we're bringing eye care into the hands of patients, and why home monitoring of vision is so vitally important if we want a sustainable eye care system. So I'm just going to share my screen with you. Carl, just so that I know time-wise, what time do you want me to finish up so that I can keep a track?
We are ahead of schedule by about 20 minutes or so. So really, feel free to take your time. Yeah.
Okay. Well, I promise I won't drone on forever. Now, if I share with you my screen, hopefully you guys can see that.
That looks good to us. Yeah.
Super. Okay. So my background is as an optometrist, an eye specialist. I've worked in hospitals in Nottingham, Cardiff, Bristol, in eye hospitals, looking after patients. And my research degree is in the early detection of eye disease. And you might wonder, well, how did I end up talking about games and eyes, and why does that matter? But I've started a startup that essentially blends vision science with video games, really simple video games on people's phones. And what that means is that we can get clinical grade measurements of eyesight onto people's phones so that they can monitor themselves. And as we go through, I'll take you around and why. So to cut a long story short, I make video games that measure stuff in people's eyes. And this is all about early detection. And so engagement is going to be the theme of what we talk about over the next half an hour or so. And ultimately, what I'm really passionate about doing is bringing healthcare into the hands of patients, empowering patients. I'm a bit of a nerd. And I'm a trained scientist, so high quality data is absolutely vital. And we'll be talking about that and gamification. And ultimately, what does all of this mean for the future of healthcare? So, the importance of healthcare at home. This is vitally important for sustainability. And we all know how under pressure the NHS is at the moment. If we think about it in a UK context, we all know that there aren't enough nurses. We all know that there aren't enough doctors and professionals. And there's more demand on our healthcare system than there ever has been. And so there's a big thing here about sustainability, to reduce the number of people who arrive in hospitals and clinics unnecessarily. So being able to provide, where appropriate, healthcare at home means that we reduce the pressure on our hospital systems and we increase the sustainability, because this is all about getting the right patient in the right place at the right time. And there are times where we absolutely need to be in hospital, and those are the patients that should be concentrated on. Those are the patients where our specialists should be investing their time. But healthcare at home is also about patient experience. If somebody had asked us 4 years ago if we would have been doing diagnostics at home, you probably wouldn't have thought that just a year later we'd all be self-testing for COVID, and the experience of healthcare. I'm not saying that testing for COVID is a really pleasant experience, but the autonomy and the power that gives us as individuals does enhance our experience of healthcare. And now lots of people, for example, will have blood pressure monitors at home. That does mean that we can participate in our healthcare at home. And that is a good experience, not to have to drag along to the GP surgery unnecessarily. And especially if we're only going in for something like monitoring our blood pressure, or if we're only popping along to the eye hospital just to read the chart, when these things can be done at home or, for example, at work, this enhances experience and it brings healthcare much closer to the patient themselves. But the reason I get up every morning is because I know how important the early detection of deterioration of eyesight is. And so eye problems, or I do bring a parallel to cancer, for example, where early detection is really important if we want good outcomes. And by allowing healthcare to happen at home and encouraging healthcare to happen at home, that means that we will identify earlier problems. We should not be in the 21st century waiting for our conditions to get worse and then treating sort of retrospectively when, in hospital. And I always find this was part of the reason I'm so passionate about what we do at OKKO Health, delivering eye care at home, is because when I worked in hospitals, I knew that 50% of my patients probably could have been looked after remotely if we'd had the right information and the right tools. But I also knew that the other 50%, quite frankly, I wish I'd seen them earlier. And I wish those patients had been able to come and see me 2-3 months before. And I would have been able to do more for them. And I would have been able to protect their sight rather than try and fix it. Another reason that healthcare at home is really important is to get reassurance that treatment is actually working. How many times have you in the audience taken a medication and thought to yourself, well, I wonder if it's working? With things like remote monitoring, finally, we can do that. We can understand if the treatment is having the effect that we expect. And that enables, from a pharmaceutical perspective, from a doctor perspective, from a patient perspective, that gives that early indication, and it gives that what we like to call in medical terms adherence. You are more likely to continue taking the medication if you know that it's actually working. And that's really important because about 50% of our medications are actually wasted. And a big part of that, I can only speak for ophthalmology, but a big part of that is because patients don't get that positive reinforcement and reassurance that it is actually working. And yes, and that leads on to this idea of engagement and adherence to therapy. And I think, this is, when we think about engagement, it's not just about entertainment, but it's about participation in healthcare. And it's about that patient feeling a lot more in control. And it should be that we get to the point where there is more of a balance of power between the patient and their professionals. And ultimately, that patient should be in control of what is happening to their own body. And in order for us to get all of these benefits that I've spoken about in the previous slide, we need to be obsessed, I think we need to be obsessed with high quality health data. And I think we've got many scientists in the room, and we will all know that that is how we make good clinical decisions. That's why we do research. High quality data is the absolute foundation for so much of what we do in science, and so much of what we do in medicine is absolutely vital. And it's only through having high quality data that we can make decisions that are meaningful to the patient. And I think what we've had when we think about medicine over the last decades is we've had data. That data has only really been collected in hospital on really fancy equipment that costs an awful lot of money. And what we've had so far is we've had the type of data collected that's been about, well, what information is useful to the doctor? Whereas really what we want to be thinking about, what we want to be moving towards, is how do we collect data which is useful for the individual and what is meaningful to the patient. And this is something that I like to remind my colleagues, my investors, the doctors that we work with. And it's so obvious, isn't it? But most of the time, patients do not spend their time in hospital. And therefore, it makes common sense to me that surely the most valuable data that we get actually comes from where the patient spends most of their time. because measurements that we take about people's bodies will be different when we measure them in an environment that they're not used to. And I'm sure many of you have heard of white coat syndrome, which is whenever you measure somebody's blood pressure in a clinical setting and they're nervous and it spikes, you're not getting, is that real high quality data? No, it's not, absolutely. And I knew also from my background in vision science that when a patient is under pressure to read the eye chart, they get nervous, because they're thinking so much relies on it. They might be thinking their driving license relies on it. They might be thinking whether or not they get a particular medication relies on it. And therefore, people get really nervous, and the data we get isn't good anyway. So patient perceived insights should be driving a patient-centered care. And this is the way I like to think of, okay, so the measurements that we take have got to be reflective of that person's real life. So it's not just about the stuff that we used to measure, gold standard measurements on fancy equipment in hospitals, but actually, nobody's really interested in data. We're interested in what do we learn from the data. And I think that when we think about healthcare at home, when we think about data that might come from our phones, that might come from our watches, or other mobile devices that we have, that's more real life data. And I say this as somebody who's been, taught to read the eye chart since I was 18 years old, become obsessed with every detail of the eye chart. And what I realized was that actually that doesn't really tell us how the patient lives. Didn't really tell me what matters to the patient. The eye chart didn't tell me how well that patient could function at work. It didn't even tell me, was that patient safe to drive? Because what's really interesting, if we think like the driving limit for an eye chart is about halfway down the chart. But if I had half a dozen patients, each who can read halfway down the eye chart, who were technically legal to drive by that measure, they might see the world in half a dozen different ways. They will. Not everybody who reads a line on the chart sees in the same way. Some of them will struggle to recognize the faces of their grandchildren, and some of them won't. Some of them will be able to work with no problem at all, with no adaptations needed in the workplace. Others will really struggle to work, and they'll need to go through a process of having their screens adjusted to make their eyes more comfortable. And some patients who have levels of vision will be struggling to work, and they'll be struggling financially, whereas somebody who read the same line on the eye chart might be absolutely fine. And so for me, I thought, hang on a second, this measurement that we've been using for a really long time actually is not serving the very people that it ought to serve. A lot of the data that we've been using in fancy equipment in hospitals has been designed to serve what's easy for a clinician or what's easy for a research study. And therefore, there's been an oversimplification. Certainly, and I can use the eye chart as an example, it's a much too crude measure of how we see the world. And what I'm most interested in as an eye professional is something that will tell me how that patient is managing in their day-to-day life. And I'm interested in what are the measurements, the data that I can take and the insights that I can generate that will tell me, is whatever treatment I'm giving, is that actually improving somebody's quality of life? And is that making a real meaningful difference to them? And so what this slide is here to represent is the idea of learning from textbooks. And I'm kind of obsessed with the fact that when I look at my vision science books on the wall there and how we've been taught to measure vision for tens of years, that actually when we deeply listen to patients and when we use data to generate insights, tells us that textbooks might be a little bit wrong, but patient data may give us a truer picture of disease. And certainly there's lots of things scraped off Facebook, for example, and nuances about how patients are describing their symptoms that quite frankly are rewriting the textbooks. There are much fewer eye professionals now writing textbooks, because we now know that the symptoms of disease are changing. And a really good example of that is the Zoe app, which so many of us used during COVID. And what that taught us was that the symptoms on the NHS or the public health websites were actually the symptoms of COVID from the first wave. when it was actually the Zoe app that was able to give us the symptoms of the second wave, this third wave. And it wasn't all about, losing your sense of smell, or it wasn't all about having flu-like symptoms. And that information we call citizen science, when people club together to tag data. And of course, they were able to get a ground truth for that data because we were all testing ourselves and being able to give positive and negative results. And I just think that's so powerful when we're able to use data to get a much better picture of a disease, when we're rewriting the textbooks, and we're able to do so in real time. But there is a difference between that citizen science approach to collecting data and gathering insights and what's actually used in clinical medicine, specifically to make a diagnosis or to monitor patients. And that's where the difference comes in between what's research-based stuff and what's actually CE marking or UKCA marking, as we now are moving towards post-Brexit. So when you look at a CE mark, you're really looking for a stamp of quality. You're looking for a stamp of assurance that the data that is going to be produced by that medical device is of high quality and it's reliable. And it may surprise you to know, or it may not with this audience, but to know that those of you who are wearing an Apple Watch actually have a medical device on your phone. And Apple did get clearance in Europe for their atrial fibrillation measure. And that goes beyond, for example, what the Zoe app did. That's gone through a prospective clinical study to say, look, in the real world, will this give us the data that indicates, for example, atrial fibrillation? What's really interesting is that Apple has to put lots of disclaimers, you'll see on that. This isn't about finding heart attacks. No, it's about finding atrial fibrillation. So I think that goes back to what we heard earlier about the gravity of the responsibility that we have in the medical profession, that we can't just say whatever we want, that we can't just claim whatever we want. And so I wanted to make that distinction between really cool stuff with data. For example, what Google DeepMind, some of you might have heard that Google DeepMind worked with Moorfields Eye Hospital to analyze lots of images of the back of the eye. And that AI can detect, for example, whether an image of the back of the eye is a male or female retina. And nobody had ever looked at the back of somebody's eye before and thought, oh, that looks like a female or that looks like a male retina. So there's some really powerful stuff and really powerful analytics and really cool stuff. But that doesn't always mean it's ready to be applied to patients in the real world. And so that's a very important distinction here. Because software is a medical device, that's what we do at OKKO Health, and that's the core. So bringing us back to OKKO, what do we do and why do we do it? And so some years ago when I was doing my PhD at Cardiff, we were playing about with the new iPad screen that had come out. I mean, we're talking about sort of 2014, 2015. And we were able to figure out that the new retina display would enable us to measure the kind of things that we could only ever have done in a vision science laboratory. And as such, being able to put stuff on the screen in a very, very calibrated way compared to what we've been able to do before. And of course, learning from the front-facing camera how far somebody was away from the screen. All of this is the bare bones of having a vision science laboratory in the pocket. So as well as, it wasn't just about can we replicate the eye chart, but what is the other stuff that we can measure? And so when we started to play around with this and when we started to develop some ways of putting things on the screen, we realized that not just can we measure the eyes, but there are experiments that we use in vision science that actually tell us how well the brain is functioning. And if we're really clever about it, we can put that on the phone as well. And I think that's pretty cool. That's got the ability for us then to be driving high quality analytics. Sorry if you can hear my cat in the background. That's got the ability for us to be driving high quality analytics, the kind of stuff that previously you may not have even got at a hospital. You might have had to have gone to university, vision science department to collect certain things, but actually potentially we've got the ability to bring this into everybody's home. And how that might change not just the diagnostics of eyes, but also the diagnostics of cognitive disease as well. So what does OKKO Health actually do? Well, we put stuff on a screen and we get patients to click it. And so what you're seeing on the left-hand side there, you're going to see circles which have a black line and then they've got a white line around them. And because I'm showing this on a computer screen, it may or may not be obvious, but some of those circles are bigger than others. You can see a little GIF of it running through there on the left-hand side. This is actually the eye chart like you've never seen it before. So what we've been able to demonstrate at OKKO is the data that we get through getting patients to click on what they can see. I mean, don't forget, patients will not click on what they can't see because they wouldn't know where to click. So we just say to them, look, click on everything you can see on the screen. Some of these, just like the eye chart, are bigger than others. It's much more fun than using an eye chart because it feels like a hide and seek game. And because of that, we're getting data about how well somebody's seeing. And not just like the eye chart where you get one piece of data from the right eye, what's the smallest they can read, and one piece of data from the left eye, what's the smallest you can read. But we actually get data about how the person interacts. We get indications when we look at reaction time and stuff like that as to how easy was it for somebody to find that. And what we've been working on at OKKO most recently is, well, what happens when we look at reaction time? Because that ended up being way more diagnostic than actually what was the smallest line they read. And so that's really exciting because a patient once said to me, I reassured him that his vision seemed stable on the eye chart. And he said, Stephanie, I recognize that I can see the same line that I saw the last time I saw you, but it's harder to see. And your eye chart has not captured that. And I wish I could go back to him now today and say, well, actually, we reinvented the eye chart and now we could capture that, which I think is really exciting. And what's on the right-hand side, you'll see a ring of dots, and one of the dots is sitting outside the circle. So all the patient has to do here is click on the dot which sits outside the circle. But if they have macular degeneration, they're going to find that quite difficult because when they look, the circle of dots is going to be distorted. And so it's going to be more difficult for them to pick out the single dot which is sitting outside the circle, because as they look with distorted vision and macular degeneration, more than one dot will appear to sit outside the circle. So nobody's ever put this before, been so innovative and so gamified when, because there's lots of music happens in real life when the patients are playing. But it doesn't feel quite like an eye chart, and that relaxes the patient. And also, they play this 3 times a week and it gives them the data back on the phone. And that was one of the critical things that we did during COVID, was really listen to the patients and have them say, here is how I want the data presented. I want to see my own data. And previously, in ophthalmology and in optometry, with looking after people with eye problems, we'd never really given them back their own data. This was something that we held on their behalf. But of course, all bets were off during COVID, so we designed exactly what the patients asked for. And I must say that was a really fantastic process. So I'm going to play you a video now from one of our patients called Len, who was one of the first people to ever use our app.
Hi, I'm Len.
Are you able to hear this okay? I can't see your faces, so I'm going to assume that you are.
In 2018, I was first diagnosed with CRVO at central retinal vein occlusion in my right eye. In 2020, I got involved with OKKO, and I've been a regular user of the app ever since. Of primary importance, obviously, is the monitoring of my bad eye, my right eye, and early detection is really important, so that if there's a rapid deterioration, I can get assistance and treatment quicker than I normally would. Of great comfort also is the fact that I monitor my good eye, my left eye. Unfortunately, that's been steady throughout this entire period.
And so what we're all about is empowering patients. Oh, let's move that slide on. What we're all about is empowering patients to capture their own data, to monitor themselves. And we used to have a situation, pre-OKKO, where patients would be very nervous coming to see professionals like myself in clinic, where they were really worried that I was going to tell them that their eyesight was failing or that they'd lose their driving license. Whereas actually empowering patients with their own data just makes complete sense in so many levels. And very, very critically, patients like Len are able to monitor their vision and get back in touch in between appointments if something changes. Now, conversely, when we go back to sustainability, what that also means is that patients who whose vision is stable and who don't need to have another appointment quite so quickly can potentially push that back. And that's what we're aiming to do in the future. So dynamically prioritizing remotely which patients need to be seen earlier and which patients can afford to wait, to make sure that we're using our nurse resources, our optometrist resources, our eye doctor resources as effectively as possible. And what we did at OKKO is actually work with a patient charity. Just going to try and push that slide back. And we've been working with the Macular Society for about 3 years now, co-designing the technology, building in a release cycle where we could learn from feedback and reissue the software. And doing that all within the construct of a medical device has been really difficult, but really interesting and absolutely the right thing to do. This has really led to a competitive advantage for us. Because we're a software medical device company and we're not a pharmaceutical company, we are able to work more closely with patients because that's what makes our technology safer. And I must say, my recommendation to anybody, if working with charities is absolutely the way to go, because you're able to really get proper feedback and really learn what end users think about the technology you're developing. So I just say, don't shy away from working with patients. So how do we see the future of eye care? I mean, if we look at where we are today and where we were pre-OKKO, somebody, and this is generalized to most diseases, but you might have symptoms, then eventually you book yourself in with a doctor. They'll there and then collect some data, and if they feel necessary, send you to a specialist. Some more data will be collected, but again, it's only at a single point in time. If a diagnosis is made and treatment initiated, then you might come back 3 months later to see if something's working. Now, that's how we used to do things in the last century, but how we plan to do things going forward is work so well with data streams, continuous data coming in, and using artificial intelligence to look at data to make predictions about health before the onset of symptoms. Because if we can begin treatment before symptoms actually start, then that's what keeps us healthy rather than treating people once we're sick. You can absolutely see how that will be analyzed by a specialist AI, that data, and then sent at the same time to an individual and a doctor. And this is what I'm really excited about. Essentially, that power balance, giving the patient the same data that you're giving the doctor and saying, look, we think something's going on here. And what that data will allow you to do is have a coordinated appointment made for a holistic, all-rounded treatment decision. And the really cool thing about using remote monitoring is that the patient can then monitor themselves. They're not having that anxious 3-month wait. Is it working? Is it working? So you can see down at the bottom these things that I think are going to be the absolute cornerstones of healthcare and healthcare for home going forward. Patient involvement, patient centricity, balance of power, and coordinated care. These are the things that I really believe are going to drive strong engagement, early diagnosis in healthcare in the future. So taking us back round to gamification and why this is so important for engagement. I mean, we're already using digital healthcare apps that promote health and fitness and wellness, things right through from sleep trackers through to period trackers and things like activity sharing as well, Strava. There's lots of things like this that we're already tracking. People are wearing rings that track their sleep, and we have many, many things. So the future is already here. And I want to touch on gamification and tell you a little bit more about what some of my colleagues are doing in this space. Because, and my colleagues, in other startups across the world. So Endeavour RX is quite a fantastic game that's been prescribed for children who have ADHD to kind of help regulate their dopamine responses and help them manage their ADHD. And this uses sensory stimuli and motor challenges to target areas of the brain that play a key role in attention function. And 68% of parents reported improvements in the impairments that their children had after 2 months of this treatment with the video game. So watch this space. There's some really interesting things happening. And going back to the research space then, See Hero Quest was a UK, I think it was UCL, project where scientists helped to gather information about dementia. And this app asked people to navigate through a quest and through a game where they had to try and find their way around. And that was really looking at spatial navigation capabilities, and it was played by 4.3 million people. So if that's not high volume data, then I don't know what is, but that's really exciting. And so I believe very much that the future of healthcare is predictive, it's proactive, personalized, and also protective. You know, I, as an eye care professional, do not want to be treating people when they've already lost vision. I want people to be able to proactively come and say, you know what, apparently there's something going on. Let's get ahead of the curve. Let's initiate treatment. And I wanted to leave you with this idea. I mean, we're here to think about medical communications today, and fundamentally, how we go ahead with how we use data analytics, how we use engagement, how we use gamified data to measure more accurately than what we've been able to do before. And that will take us into this proactive, predictive phase. That is absolutely going to change how a doctor speaks to their patients. That is absolutely going to change how, as pharmaceutical companies, we're going to do our marketing, both to doctors or perhaps to patients in the US. It's going to change a lot of interactions. What happens if the patient is the first person to know that something's going on? And there's so much here. So whether we put our hat on as a healthcare professional, as a pharmaceutical executive, as a medical writer, as a patient, as a nurse, as a doctor, there are so many different things that are going to change as we move forward, and as eye care, as healthcare becomes protective. And I just really hope it's going to help us to focus on healthcare rather than sick care. And this is all going to be driven by having high quality data in everybody's hands. So with that, I want to say thank you very much, and excited to take your questions. I'm also going to be around at our OKKO Health booth as well. So thank you very much, and I'll stop sharing and pass back.
Brilliant stuff. Thank you so much, Stephanie. It's so interesting. It's so fascinating. And we've actually got quite a few questions in. So yeah, I just take this opportunity just to say thank you to all of the speakers today for giving such interesting talks. And yeah, we're going to move on to a little Q&A session now. So you've been putting in a few questions, and I think since you're sort of still in the hot seat, Stephanie and Caroline, if you want to come forward as well, we can sort of take questions together. So where to start? I think one interesting question here is: do you have any plans to branch out into other diseases and treatment areas, Stephanie?
Yes, absolutely. So at the moment, we're concentrating on macular degeneration. Diabetic eye disease is up next. And we've got stuff in the pipeline for glaucoma, which is a very common eye problem, and also dry eye, which makes a lot of people very uncomfortable. So we've got all of those things in the pipeline, and I'm hoping that OKKO will really be the digital health company for eye care as a whole, because very few of these eye conditions exist in isolation. So thank you to, I think it was that Bruna, for that question. Thanks. And it's happening. I just wish we could go faster.
Nice one. One more for you, Stephanie, here. Is OKKO for people who have already received a diagnosis for a disorder, or for anything else?
Yes, at the moment it's for people who've already received a diagnosis, but my dream is that in the future this will be something that just sits in the background of all of our phones for us, so that in the future, you know, if we're at risk of something, then we'll know quickly. So I think that's probably about 5 or 10 years off, but we are working on it.
Super duper. Cool. Hang tight. I'll come back to you. So Caroline, we've got a couple in here. Where should we start here? We'll go for a couple of questions. So what's been the most important focus for the Monster Academy when it comes to the types of training or the types of things that we're focusing on?
Yeah, I think that's a great question, and actually quite hard to answer, because we cover so much in the training. Actually, we cover from all different types of medical writing that the medical writer might get involved in, from writing for the general public to healthcare copywriting and advertising through to writing for publications. But actually, I think what is really key is to be really focused on those agency skills. So we focus on how you interpret a brief, how you really ensure you have that great QC and an intro to compliance as well, and how you build those great relationships with clients. And I think that's something that perhaps you don't get as much training in with other courses that are available elsewhere. So I think that's really key focus for our training.
Superb. Thank you, Caroline. And then one other one, sort of like an industry sort of wide thing that's been going on. Apparently, Peter Llewellyn has run a survey recently about sort of work quieting down for freelancers in Q1 and Q2. And the question is, with the lack of medical writers in agency, do we have any thoughts on why there is a disconnect?
Yeah, I've seen quite a lot of chat about this actually on socials, and I have seen that Peter has done that work. And I think firstly it's important to notice that it is normal to have fluctuations in the amount of work that is available for freelancers. Often we see it can go quieter in the summer months, which it happens as farm agencies get quieter with the holidays. And I think it's important also to say it's probably a bit too early to know exactly the trends that are happening in the last 12 months. But I agree, we have seen that. I think a couple of possibilities are that although the trend has been in the last few years for pharma to outsource a lot of their writing, we do know that actually at the moment as well, some pharma companies are growing their writing teams internally within pharma themselves. So maybe there's lack of some farmers are not outsourcing to freelancers as much. And also some of the larger writing companies and agencies have developed their own graduate training programs over recent years, and they have taken up lots of new writers. So maybe some of the briefs that would go to freelancers at the moment are being taken up by the more junior writers that some of these large companies have. So I'd say don't focus too much on the trends over the last couple of quarters. I think, we really need to look at the bigger picture and wait for a bit more data to come in before we get too concerned about that.
Brilliant stuff. Thank you. There's one question here about how do clients enjoy working with a remote team over an in-person team? Have they given any feedback on if it's easier for them or more convenient? I can take that one. That is interesting. And I think before COVID, couldn't probably have imagined working with clients without having met them. When you have to, go through such stringent sort of processes. To win work and such, but I think it's become so familiar. People have got so used to using digital technology and Zoom that these days we rarely get asked to meet clients in person, and the clients that we work with are loving using Gather with us. And for me, it gives them almost better access to us. We can give them guest access, they can hop in and use it. So whenever they've got a question, they can kind of come in. Maybe that could go too far the other way, but so far it's working really well. It's working really well, and so that's the answer to that. One more for you, Stephanie. So back to sort of gamification. Have you had any barriers to the adoption of gamification with OKKO? And if so, how did you overcome?
Yeah, so some of you might have gathered that the app that we're currently, the medical app for macular degeneration, is targeted towards older people, so people sort of 60 plus. So one of the biggest barriers that we would have is often a perceived barrier of how confident they might be using technology. So what we did in our first pilot with Nottingham Hospital was realise that those people who have a mobile phone that they use every day, because most older people will have a mobile phone, but not all of them feel confident to use it. And so what we started out with is saying to folk, do you have a mobile phone that you feel comfortable using, use every day? And if the answer is yes, then that's the first target grip for our technology. So I think initially we thought we could teach people to use a phone in order to use OKKO, but that wasn't quite as successful. And I think, so we're really, there's probably the vast majority, 70% of the patients in a hospital will have a phone that they use. 70% of the older patients will have a phone that they use daily. So we go for those folk. one of the other barriers as well is that some people much prefer to use an iPad, and our technology works well on that as well. So they'll use an iPad instead, and we calibrate accordingly, so it still stays at the same size regardless of what device that they use. Yes, I mean, my feeling is that it's sort of a perceived barrier, often more than anything else. And so what we do is get the nurses in Oxford and Nottingham who are currently using it to install for them, install and just download the app and put in the passwords. And then what we also did was we used facial recognition, which helped because people didn't have to remember an additional PIN number, because it's a medical device. The data does need to be protected, and so they do need a PIN or facial recognition to get in, because you don't want the grandson finding it and use it, having the grandson's data in instead of the granny's data. So yeah, it's been an interesting journey, and I think making videos so that patients can remind themselves why they're doing this and what they can expect to gain. Yeah, there's been lots of things, but the barriers are much less than you would have thought. And I think that comes from COVID, because so many of these patients will have been using Zoom to keep in touch with their grandchildren. So the barriers really drop through the floor.
Brilliant. I'm glad to hear that it's not too much trouble for people to adopt. Excellent. Well, I think there's one last little question, just a technical one about the VR session later. Do you need a VR headset to join? No, you don't. Just come along, and then you just press X in the room, and it will take you to a link. You click the link, and then you can watch that. There are a few other questions, but we haven't got time to sort of do all of them. I think now would be a brilliant time to sort of end there and thank everybody again for taking part and for everybody coming. I'll just share one last slide. Bear with. There we go. Hopefully you can see that. So what's going to happen now is we're going to shortly head out into the main conference area for the exhibition, so we can speak with each other, speak with the speakers, speak to the sponsors, find out what they do and how they may be able to help you. You're also going to have the opportunity now to visit all the other rooms. So they're unlocked. The games room, go and challenge a colleague or a member of your team for a game of Scribble, code names. Let us know who is the victor.
Carl, actually, just to let you know, we can't see your slide actually if you're trying to share a slide with us.
Oh, how's that?
Yeah, that's better.
Oh,
yeah.
Thanks. Didn't really need to see anything there. But thank you. Or instead of sort of having your lunch indoors, you could feel free to wander around the outdoor space where you can drive the go-karts about and pet the animals. And then, we'd like to invite you to turn on your microphones and videos as you wander back around. And quite impressively, we are pretty much on time. I can't quite believe it. We're going to kick off the session for the exhibition now. Maybe take a picture or grab a screenshot of the timetable for this afternoon. If you are going away for lunch and coming back, feel free to just hop in. We're probably going to run the Word Monster office tours slightly sooner. So once you're sort of done chatting with everybody in the exhibition, wander over to the MonsterComm logo, where we can start taking small groups across to the Word Monster office. They'll only be short, the tours, probably 5-10 minutes, where you're going to portal over from the rooftop area. And then come along to the VR experience, taking place at the VR Hall 1:30. And then lastly, please come along, bring your friends, bring colleagues back. There are prizes to be won. We've got a VR headset for first prize, so £50 vouchers for second prize, and £25 vouchers for third prize. So yeah, that you can help each other as a team. There's if you like. So definitely bring your buddies. And that is it. Thank you very much. I will see you out in the foyer. Let's go.